I am Dr. Sekar. I am a vascular and endovascular surgeon. Today we are going to talk about diabetic foot disease, why people with diabetes are losing their legs. You know, there is blood vessel, there are vessels which carry good blood, there are vessels which carry bad blood. The one that are carrying good blood is called artery. People with diabetes develop blocks in the blood vessels to the legs. That's why they develop gangrene. And gangrene, by which we mean, is death of the tissue. This is more common in people with diabetes, with people with blood pressure, people with high cholesterol, and most importantly, if someone smokes or uses tobacco in any form, they develop arterial blocks. Aging is a natural phenomenon when blood vessels do get thick. Age coupled with diabetes and smoking, people tend to develop blood vessel blocks all over the body. See, this block can happen in any part of the body, and the symptoms vary according to the region that is involved. If the blood vessel going to the heart gets blocked, which is the very common one, a patient develops a heart attack. And if it develops blood vessel block to the brain, then they develop stroke. Same way, if the blood vessel to the leg gets blocked, people can develop gangrene. I think there is always, everybody would have come across people, with older people developing ulcer in the leg and ending up with amputation in olden days. All these were due to blocks in the blood vessel to the leg, and the tissues are dying, and there were nobody to correct these things. But now the science is advanced. We can correct these blocks just like the way we correct the blocks in the heart. We can do angioplasties without surgery, or even open bypass, just like what is done in the heart. First, we must know what happens when a blood vessel to the leg gets blocked. The initial symptoms are when the patient walks, patient develops pain in the leg. And this pain, after some time, gets worse as the block increases. Patient is not able to walk the same distance like he was able to do earlier. And then ultimately, even walking short distances produces pain, forcing him to take rest. And in such a situation, small little injuries to the toe, wearing new chappals, shoe bites, or a thorn prick, something like that, induces an ulcer. Any ulcer requires more blood. And when the blood is not coming, that area becomes black. And this is what we call as gangrene. Once gangrene comes and the tissue is dead, we cannot save that toe. It will have to be removed. So we have to identify this before such a thing happens. So all diabetic patients must have a vascular assessment. The vascular assessment is just like we feel pulses in the hand, we can also feel pulses in the leg. That is the simple clinical examination. And next is a non-invasive test, what is called a Doppler Examination, where by an ultrasound machine we can actually look at the blood vessel and assess the blood flow and assess the block if it is there. And if the symptoms warrant, we can go ahead and do an angiogram like that is done in the heart. Initially, all these patients, we treat them with medical therapy. This medical therapy, foremost, is to stop smoking. You have to stop tobacco in any form. Smoking, whether it is cigarette, bidi, or cigars, or taking snuff, or using pan parak, or tobacco chewing, any of these must be stopped completely. Because tobacco is one which causes spasm to the blood vessel, makes the blood thick, and develop acute blocks in these vessels, causing serious trouble to the patient. So tobacco must be stopped. And the next important thing is keep walking. In fact, the slogan of vascular surgery is stop smoking and keep walking. If you can do that, majority of the time you can avoid problems of blood vessel or blood circulation to the leg. And the next, we also use blood thinners like aspirin, clopidogrel. A lot of new drugs have come. You can take any of these things. Anybody who is diabetic with blood pressure or all these high-risk patients, we advise routinely blood thinners so that they don't develop a block. And if the patient does not improve with all these measures, of course, another important thing is reducing the cholesterol by anti-cholesterol medicines, controlling the diabetes, controlling the diet so that your cholesterol also comes down. All these are important components of medical therapy. If the medical therapy fails, then we think of intervention. Like I said before, the intervention can be open surgery or by a minimal access endovascular surgery. In open surgery, we used to make long cuts in the leg, remove the vein, the same vein which is used for heart bypass. That is used for doing a bypass to the leg. That is, we connect from an upper artery which is normal to a lower artery which is beyond the block, so that the blood flows to beyond the block. Nowadays, the endovascular treatment has advanced quite a bit, where we are able to offer non-operative treatment for majority of these cases. We can put it is just done through a small needle hole in the groin or in the arm, through which we pass a wire, and this wire is taken across the block, and on top of the wire we pass a balloon, and this balloon dilates the blood vessel. In some cases, we may have to use a stent to prevent the block from coming back. Now, recent advances is that we have balloons coated with special drugs, the drug-eluting balloons, which will deliver these drugs at this points of block so that the block does not come back again. So these kind of treatments are available. So once we improve the blood supply, the ulcer will heal, or even if there is a gangrene, the gangrene will get limited. So whatever is dead cannot be brought back, but whatever is dying can be brought back, so that we can minimize the amputation and the patient can walk normally afterwards. And all these patients must have a lifestyle modification, wear proper footwear, which is very important, and continue the medical treatment and have periodic checkup. If you can do that, you can live happily with your legs intact. The diabetic patient, the one fear that all of them have is the fear of losing their legs. That can be avoided if you follow these simple principles.